So you gather your equipment. You might want to wear a gown. You might want to wear a mask with a face shield. I would recommend. And we're not going to do that today. And you also need a non-sterile drape, which we're going to pretend that this is what it is. Okay. But you're going to go into your patient. You're going to introduce yourself, tell them what you're going to about to do, and then you're going to do a respiratory assessment: heart rate, respiratory rate, breath sounds. If the patient is not clear, coughing, or you hear rhonchi, then you're going to want a suction first. That'll be important. Save you and them. Okay? Hence the face shield. But once you've done that, go ahead and put your non-sterile drape on. And gloves. Well, we'll pretend I have gloves on.
You want some?
Gloves?
Yeah, that's fine. Small, preferably.
We have large.
It's fine. It's fine because I'm going to put sterile gloves on in a minute, so it's fine. There's some debate on whether to take off the sponge, the old sponge, before or after. I usually take it off before, but you'll want to wash your hands, put on gloves, non-sterile gloves, and I go ahead and I remove my old sponge. We're going to leave the ties on, and you'll want to assess your sponge for like color, consistency, especially while she's eating. All right. But once you've done that, you're going to go ahead and go to your sterile field. Okay. So once you've done that, wash your hands again. You open up your trach kit. Careful not to touch the inside. You'll take your sterile gloves and you'll place them to the side. Okay. Then you're going to take your sterile drape and you're just going to open up by grabbing the corners only in front of you. And then, of course, this is your sterile field, okay? You don't want to really reach over it, or you want to avoid it as much as possible. And you're going to take your container, and you're just going to dump your trach kit out on that. And then inside your container, which you don't want to touch the inside of, you've got 3 compartments. And we're going to do this traditional trach care, even though we have disposable inner cannulas now, we're going to pretend we don't, okay? So, one container is going to be half strength peroxide, so half peroxide, about a ½ inch of peroxide. Just pour it in. And you want to check the expiration date on your peroxide, by the way. And then normal saline, about another ½ inch, just to dilute it. And then normal saline in your other 2 compartments. Okay? And then once you've opened the normal saline, usually they come in the small bottles, but if you happen to have anything left over, you can date it and time initial date. It'll last for 24 hours. Okay? But then you put your non-sterile gloves, and once you've got that out, you still have your non-sterile gloves on. You can go ahead and take the inner cannula out, and this is a Shiley, so it's got a locking mechanism on it. All Shileys have a lock, some sort of lock, whether it be a pinch or a turn or a what have you. So we're going to take that out, replace your oxygen, and then you're going to drop it in your half-strength solution, okay? At that point, you're going to put on your sterile gloves, okay? And I'm sure you've learned all this part, right? Is that a yes?
Yes.
And these aren't in right, but we're going to pretend I did it exactly right. Okay. So once you've done that, then you can separate all your equipment on your trach kit. Okay, and you've got a little brush here, you've got pipe cleaners, Q-tips, and gauze. Okay? So the first thing I'm going to do is I'm going to take my brush, I'm going to go to the half-strength solution, and I'm going to go ahead and clean my inner cannula. You want to make sure all the secretions are off of it. And you can clean the sides. Okay? Keep a hold of the top, not the actual inner cannula tube part. Once you get that done, you're going to rinse it in just one of the compartments of normal saline. Okay? And then you'll want to dry it with pipe cleaners. get the inside, and then the outside with gauze is fine. Okay? And then you can put it back in at this point. And you start at 9 o'clock, and then you kind of turn to 6 o'clock. Once you get it in, you clip it. Okay? At that point, you're really not sterile anymore. Now you're just going to clean the outer flange. You can use Q-tips, you can use a sponge, but you're going to use your normal saline that's in the compartment you haven't used yet. Okay? And you're going to clean in one direction, under, and then drop it, get 2 more. Okay? And then over. And then you can use your flange. Clean your flange. Alright? And that's it so far. And then you gotta change your, put your tie on, and that's what I'm missing. Do you have a tie somewhere? Sorry.
See if I can find one that's
Okay.
You had in the kit. You had 3 compartments.
You have 3 compartments, and I try, when you start doing this, try to use the same 3 compartments all the time, so there's
Right.
never a question of which one you have peroxide in.
One has peroxide and 2 have saline.
Correct.
Okay.
One's half-strength peroxide. But you also have to remember, you have to really dry it well, because do you know what happens to peroxide when it comes into contact with it will foam up and it will fill your line, and then it crystallizes, and then you can't move it. Now you have to stop what you're doing and get a whole new suction tube.
When you say half.
Half strength, so
So
half
you're
peroxide,
mixing it
half normal
half-
saline,
okay.
and then 2 plain
Regular
ones.
saline.
Yeah.
So what did you use the peroxide for?
The peroxide is, I clean that for the inner cannula. Yeah, only. Because once I've cleaned it in the cleaned the inner cannula, then it's contaminated. Then I move on to this next container for my normal saline to rinse it, because it is very irritating to the skin. Then for that last one is what I use to clean the flange and around. It's just normal saline.
So that peroxide rinse is half peroxide, half saline?
Right, normal saline. Yeah.
Does it matter what's on the chest? What was that again?
I put it just straight down, because when you start pulling on that inner cannula,
But it doesn't have to be like a sterile. It can just be a towel.
non-sterile.
Okay.
It's just to protect their gown, because they are going to cough.
Well, it's nurses list too.
They are going to cough. Cool, thank you. Yes. Okay. So we've got our tie on right now. We're going to put a new tie on. We're going to pull back the oxygen. And you don't ever untie without having a hold of it. Okay? So I'm actually going to go ahead and slide half of my tie on now. Okay? Before I untie the old one. Alright? But once I do, and of course my patient would never be at direct aim at me, but we can't really move his head. But yeah, this is not a good position to be in. But I'm gonna stay a hold of him right here, okay? I'm always gonna hold that. And I'm gonna go ahead and get his new sponge. And I'm gonna untie that. And I'm gonna go underneath. Reach around. Never letting go of that trach, because I'm telling you what, a good cough and it's gone. And they're going to be coughing while you're holding it.
Is this painful for them?
No.
Just
I
it
don't-
causes
I think
them
it's
to cough, but not
uncomfortable
painful?
because it makes them cough. It's irritating to their throat.
It's not causing them like a great deal of pain.
You'll have some that will say it hurts. Some will say it's too tight. By the way, 2 fingers, just like a dog collar, is tight enough. You want to be able to get just 2 fingers under there. A lot of them say it hurts. That it just depends on the patient. But I think it's just irritating, just like suctioning. Suctioning, I've asked many patients. They say it does not hurt. It just makes them cough.
Okay.
And this is the same. But then you'll have the ones that never want to be suctioned, that don't like trach care, and those are the ones that
Get infections.
Yeah. And that's why you're doing it. Really, is you're trying to prevent infection by keeping it clean. You go by your hospital policy, but normally it's every 24 hours or PRN. Anyway, you get rid of your equipment, but once you finish your trach care, you really need to reassess your patient. You're assessing all the way through, but you're going to assess pulse ox, heart rate, respiratory rate, and breath sounds. And you may need to, again, suction, because a lot of that moving around gets secretions going, so you may have to suction again after that.